young people have the powerful potential to innovate innovative solutions to the most pressing global health challenges. We are also often influential drivers of global social justice movements. However, adolescents often face significant barriers to high-quality care, such as obstacles in accessing comprehensive sexual and reproductive health services. In global reproductive health, according to the World Health Organization, the leading cause of death for girls ages 15 to 19 is complications from pregnancy and childbirth. During COVID-19, more than ever, understanding how to implement effective frameworks for global reproductive healthcare, especially to address inequities, is vital. Tapping into youth networks and expanding youth integration into contraceptive research and development may prove effective strategies to achieve better reproductive health outcomes worldwide. Today, I want to share a story about a personal experience with youth advocacy and promoting health for everyone. It begins with the Contraceptive Technology Innovation, CTI Exchange at FHI 360, a platform intended to grow the global contraceptive research and development ecosystem through collaboration and knowledge sharing. While interning with FHI 360 and working with the CTI Exchange, I realized many inequities and barriers to adolescents having equitable access to affordable and acceptable contraceptive technologies. I also noticed the potential for more integration of youth voices in the current contraceptive R&D landscape. To generate positive change towards social justice, I turned toward youth advocacy. Through the CTI Exchange last summer, I called for youth stakeholders in the field of contraceptive R&D, and soon 40 passionate and talented young people from 11 countries joined the initiative to engage youth voices in the contraceptive R&D ecosystem and build up the next generation. During our inaugural meeting, introductions included individuals sharing their name, background, as well as their favorite foods, not only making for a very mouth-watering conversation, but also highlighting the global roots of this youth movement. The group included students interested and invested in reproductive healthcare, as well as prominent youth activists and coordinators for the International Youth Alliance for Family Planning, young scientists at universities and research centers, among many others. All shared the passion for and aim to grow knowledge, access, and effectiveness of reproductive healthcare for adolescents. During that first meeting, we shared goals for the council, brainstormed focus area ideas, as well as created guiding principles for the council, including prioritizing inclusion and equity, interdisciplinary and community-centric strategies, as well as ideas of including youth with disabilities. Now, building off of the work of that first meeting, this group has inspired the beginnings of a virtual global community for adolescents passionate about contraceptive technology innovation and impactful work on how COVID-19 has specifically affected sexual and reproductive health care for youth. We are working on a YSRH Youth Sexual and Reproductive Health social media campaign to compile vital information on contraceptive R&D for youth, motivate young people to engage in the field, and connect with researchers working globally with a focus on adolescents. Furthermore, we are growing the global contraceptive R&D ecosystem through engaging in mentorship possibilities with current researchers and experts in the field. I cannot wait to see what other innovative approaches to global health challenges are generated from this movement. And ultimately, our hope is to build the next generation of contraceptive innovators who continue to grow the field of contraceptive R&D. Thank you so much for listening to this story.